Come in.
Hi, how are you?
I'm good. How are you?
Can I take your armband? Can you state your name
J.D. Williams.
and date of birth?
04/13/1999.
Okay, and can you tell me what city and state you're in?
Humble, Texas.
Okay, my name is Kim and I'm going to be doing your head to toe assessment on today. Can you tell me why I'm here?
To do the assessment.
Okay, very good. The patient is alert and oriented ×4. Okay, I'm just going to go over a few questions with you if you don't mind first. I want to go, do you have any illnesses or past history of any heart failure, respiratory issues, anything like that?
No, ma'am.
Do you have a family history? You know, anybody who had cardiovascular disease or like a heart attack or stroke?
Not that I know of.
Any diabetics or anybody who had high blood pressure or diabetes? Okay. And you don't have any of those, do you? Okay. One other thing I want to ask you is, are you in any pain at this time?
No.
Okay, very good. Do you have any childhood illnesses that you know about? Any birth problems when you were born?
No.
Okay. Are you allergic to any medications? Any food allergies?
No.
Okay. Or about environmental, like pollen or sun or dust? Okay. Not that you're aware of, you none at all.
None at all.
Okay. Very good. Are you currently taking any medications?
No.
Okay. Not even over the counter, like vitamins? Okay. Very good. How about your day-to-day activities? Do you work? Do you go to school? You work? And you're satisfied with your job?
Yeah.
Okay. Are you married?
No.
Have any children?
No.
Okay. Do you are you on a specific diet?
No.
Are you on a regular diet?
Regular day.
Okay. Do you exercise?
Yes.
Okay. Very good. Frequently? Very good. Do you currently live with your wife or
No, mom.
girlfriend? Okay, your mom. How is home life? Is it okay?
Yeah, it's pretty good.
It's stable. No problems. You feel safe at home. Okay, that's good. What about work? You're satisfied with work? And you have a good social life, family, friends, no problems there. Do you have problems dealing with people outside of family or friends?
No.
You're good communicating and everything? Okay, very good. What about any use of cigarettes? Do you smoke tobacco? Any drugs? Alcohol use?
No.
And nothing? Okay. What about depression? Have you dealt with any type of depression or feeling sad or lonely, any kind of depressing factors?
Sometimes, but like not as deep as, I want to kill myself in the way.
Like you don't have any kind of mental disturbance like
Yeah.
psychosis or schizophrenia?
Yeah.
Nothing like that? Okay, very well. I'm just going to, as I do my head to toe assessment, I'm going to still evaluate you and ask you more questions as we go along. If I think of anything, I'll come and ask you about that, okay? Well, the first thing I'm going to do, I'm going to check your blood pressure. Have you had any problems with your blood pressure?
No, not that I know of.
And you haven't had a temperature or anything? When was the last time you went to the doctor? You had your yearly physical? Okay. Well, it'll be good if you have a regular physical. Just relax your arm for me. Yes, it's good to have a yearly physical. You want to see your doctor on a regular basis so that, if anything does happen, you'll be aware of it, okay?
Okay.
Do you have a primary doctor?
No.
Okay. Well, whenever you get a chance, you might want to get that information. Try to see if you can get a regular doctor so you can build a relationship with them. Blood pressure 137/82. Your pulse is 64. Okay, so now we're going to take a temp. (96.8). But I know I use the monitor to check your heart rate, but I'm gonna also use my watch.
Okay.
Okay, you have 60 beats per minute, okay? Okay, another thing I'm going to do is I'm going to ask you about, you can check your level of consciousness. I'm going to ask you to try to remember these 3 words for me. Cat. Repeat them.
Okay.
Microwave.
Microwave.
Popsicle.
Popsicle.
Okay. Now I want you to kind of recall an event that happened in your past that kind of meant something to you, like a special event, and just give me a brief detail of that.
Okay, I remember this one time we had went on this cruise, and I was going to go get some glasses, and I didn't want to go get them, but y'all forced me to go get them, so I had to just go get them. So I went down and got the glasses, and I came back to the room, and I was surprised by my people. And so that was one event that I remember that, you know, kind of had me, you know what I'm saying, surprised and happy.
That's good. Now, can you recall those 3 words that I told you to remember? What were they?
Cat, microwave, and popsicle.
Okay, very good. Now I'm going to also evaluate, the patient did respond to my questions appropriately, and he is sitting upright. He has good posture. He is aware of his surroundings. He is calm. How are you feeling? You feeling okay? He's answering everything well. I don't see any distress noted here. Now I'm going to, did I ask you, I did ask you about medications. Are you spiritual? Do you have a religion or anything like that? Are you, what is it?
Christian.
Okay, very good. Well, the one thing I'm going to do, before I start my head-to-toe assessment, I'm also going to ask you I'm going to evaluate your cranial nerves. Can you puff out your cheeks for me? And show me your teeth. Can you frown for me? Can you squint real hard? Very good. Now I'm going to check cranial nerve. That was cranial nerve 7. I'm going to do cranial nerve 5. Can you bite down for me? And can you bite down again for me? And can you open your mouth to resist it? Very good. And I'm also going to get 2 tools. I'm going to ask you to close your eyes and tell me where I'm placing it and whether it's dull or soft, okay? Close your eyes for me. Dull, soft, and where I placed it.
In the middle of my forehead.
And it was what? Dull or soft?
It was soft.
You sure? Let me try it again.
Oh, dull.
Okay. Do another one. Tell me whether it's dull or soft and where I placed it.
Okay. It was soft and it was on my chin.
Okay, very good.
It was dull and it was on my chin. Soft and it was on my cheek. Dull and it was on my cheek. Soft and it was on my forehead.
Very good. Those are testing your cranial nerve 5. Now I'm going to to assess your face and start off with your head, okay? And just let me know if you feel any pain. Have you had any problems with your scalp? Have you had any dandruff or any missing hair, any baldness, or anything like that you've experienced?
Just dandruff.
Okay, let me take a look. Any pain or tenderness?
No.
Okay. At this time, I'm not seeing any dandruff. Your head is clear of any lesions, any masses. I'm not feeling anything. The hair is dark, probably black to a dark brown. It is evenly distributed. The face, what is your ethnicity?
Black African American.
Okay, and his color of his skin does matches his ethnicity. His face is symmetrical. His eyes are symmetrical. His ears are symmetrical. His nose is midline, and his eyebrows is also symmetrical. And you had no pain or any tenderness as I palpated your head.
Mm-hmm.
Okay. Now I'm going to move on to the eyes. I'm going to check your conjunctiva.
Okay.
Well, right now I'm evaluating that they are equal, they are symmetrical, and I'm going to look at your conjunctiva, and it is pink and moist. I'm going to feel your lacrimal, and it is free of debris. The eyelids, the eyelashes are evenly distributed, and as he blinks without difficulty, and they do meet. His upper and lower lids do meet. And I'm going to look at your sclera for me. I'm going to ask you to look up, look down, look left, look right. And the sclera is white. And open up. The pupils are round and about 3 millimeters. Now I'm going to get my ophthalmoscope, and I'm going to look into your eyes and check out your iris. I'm going to ask you to look straight into the lens, okay? Okay, his pupil is round, and his iris is flat, and I see no rigid borders, and the red retina was visible. I'm going to do it. Look straight for me. Okay. Same thing, the pupil is round, the iris is flat, I see no rigid borders. And the background is like orange, it's red. Okay, now I'm going to ask you to follow me to the Snellen chart where I'm going to evaluate your vision. I'm going to ask you to cover one eye. As I assess one eye, you're going to read the chart for me. This chart is equivalent to 20-foot chart. Just follow me. And we're going to start, if you can, possibly cover your right eye first for me. Okay. We're going to start off trying to read the smallest line first, okay?
Okay.
If you cannot read it at all, say, I cannot read it. This is the smallest line. Not line 9.
Okay.
Can you read it?
Con.
Okay, let's try.
L E F. I don't know what that is. U F L R H and T.
Okay, let's try line 8.
Okay.
Go ahead. We're gonna start.
F right? No, D E F F O T E C.
Okay, let's switch to the other eye for me, please? And we're gonna try the line 9 first.
Okay. L E F U no. Yeah, I don't know.
Okay, we're gonna move back to line 8, okay?
Okay. Okay, D E F F O T Z C. I don't know.
Okay. The vision chart this is just a sample vision chart, but according to this chart, your vision is around 20-25, which means that at a person standing 25 feet, they'll be able to read this line. So you just have a small stigmatism, but you may want to get that looked at by your eye doctor. Okay. Okay.
Okay.
I'm gonna also do the corneal eye reflex. I'm gonna point this light in your eye. I just want you to stare ahead at an image, and I'm gonna look at the corneal eye. Okay. And the cornea does have the reflection of the light in both eyes parallel. Now I'm going to check your pupillary response. I'm going to dim the lights. Okay. I'm going to check your pupillary response, okay? Look straight ahead for me. Very good. Look in the other eye. Very good. Very good. Oh, very good. And the pupils did constrict. Next, I'm going to do, I'm sorry. Okay. Can you stand up for me? I'm going to do the cardinal field of gauge. I'm going to ask you to follow my pen, leaving your head facing forward and your eyes only, okay? I'm going to put this 12 inches away from your face. You ready? Mm-hmm. Very good. Now I'm going to test for accommodation. Keep your eyes following the pen. Okay, very good. The patient did have, the pupils were equal, they were round, they were reactive to light, and they did accommodate. Thank you. I'm going to do one more test with you. I'm going to hold this card over my eye, and you stand up again for me, so. Hold the card. Come this way. I'm going to hold the card over my right eye while you hold the card over your left eye. And then let me know when you see the pen. No, just let me know when you see it. Keep your eye on my eye.
Okay. I see it.
Okay, very good.
I see it.
Okay, very good. Now you're in the other eye.
I see it.
Very good.
I see it.
Very good. Okay, the next thing we're going to do, I'm going to check your temporal pulses, and they are equal and a +2. I'm test your temporomandibular joint. Open your mouth for me. Close it. Open. Okay, close. Good. Now I'm going to test your ears. Just get a couple of utensils. I'm going to inspect auricle, the lobule, and the truncus. Have you had any ear problems? Okay. And as far as your vision is concerned, did you have any Do you wear glasses? I'm sorry, I meant to ask you that. Okay, and you hadn't had any problems with leakage or drainage. I did ask you that, correct? Okay. Now I'm gonna ask you about your ears. Have you had any problems with your ears? Any earaches in the past? Any drainage or oozing that you know about?
Not that I can recall.
Okay. I'm going to take my ophthalmoscope. My otoscope. Sorry.
Okay.
I'm going to take my otoscope and I'm going to inspect the inner ear. The upper canal is clean. I see a small thing of sebum, and the tympanic membrane is pearly and gray. And this is the left eye, and the cone light is at 7 o'clock. And that's good, and that's where it should be. Same here, I'm gonna pull them back, and I'm going to, the ear canal again is clean. The tympanic membrane is gray and pearly. And the cone of light is at 5 o'clock.
Can I get a Q-tip?
Now I'm going to test for some hearing. I'm going to use my
Tuning fork.
My tuning fork, and I'm going to place it on your head, and also I'm going to feel for your mastoid process. Okay, very good. It's there. And I'm going to do the Rhines test. Okay. What I want you to do is listen for the vibration and hear the sound. Okay, let me know. You can't hear it? Tell me when it stops.
I can hear. Oh, it's
You hear it?
yeah, it didn't stop.
Okay. Now I'm going to do the Weber's test. I'm going to do the same thing, but I'm going to place it on your forehead. I'm going to place it on your head, and let me know if it's equal on both sides, okay? It's equal. Do you hear the sound equally on both sides?
Mm-hmm.
Very good. Okay. The next thing I'm going to do is I'm going to do the whisper test. I want you to repeat the words after me as you hear them, okay?
Elephant. Rainbow. Football. Michael Jordan.
Very good. Okay. Now, the next thing I want to do is I'm going to assess your mouth, your throat.
Mm-hmm.
Okay. So I'm going to, as of right now, your lips are moist. I see no blisters. Have you had any fever blisters in the past? Any ulcers right now? Any lacerations? Okay, and as far as your mouth is concerned, you have any pustules or any kind of lesions on the inside? Okay. I'm going to get my change gloves. I'm going to use my hand sanitizer. Okay, and I'm just gonna right now inspect your mouth, your lips, your tongue. I'm gonna look at your throat. My pen light. Okay. Open your mouth for me. The oral mucosa is pink. And the gums are good. I see no abnormalities there. Can you lift up your tongue? Very good. The hard and soft palate is clear of any lesions, any masses. I see none. The teeth, he does have a few cavities. His teeth are intact. Can you stick out your tongue? Very good. Now I'm going to use my tongue blade. I'm going to just move your tongue to the side. Okay. Now I want you to say ah. Stick out your tongue. Say ah.
Ah.
Very good. The uvula is midline and it does move up. Now I'm also going to check for your gag reflex. I'm going to stick this back and I'm going to check for the reflex, okay? That's the response. That's the response that we're looking for, okay? Now I'm going to also assess for the tongue strength. Can you put your tongue to resistance? Very good. Tongue to resistance. Very good. Now I'm going to check. Let me look at your tonsils. Let me open it. Okay, the tonsils are pink and I do not see any lumps or lesions. Very good. Now I'm going to check out your taste real quick. I'm going to have you taste a few things and then tell me, are they salty, bitter, or sweet, okay?
Okay.
Stick out your tongue.
Do it again, like this.
Oh, let me do it. Let me do this one first. Go ahead.
Salty.
Okay.
Sweet. Bitter.
Okay. Very good.
It's not a good mix.
Okay. Now I'm going to use my hand sanitizer. And now I'm going to move on to inspecting your nose and your sinuses.
Okay.
Now, have you had any problems with your, as far as breathing, any mucus, any congestion, anything like that?
I mean, when I was sick, but not as of now, no.
Okay, we'll put on some more gloves. Okay, now as I inspect your nose, I don't see any abnormalities. I don't see any drainage. I see no mucus coming out of your nostrils. And I'm just going to get my, tell me, do you feel any pain?
Mm-hmm.
Okay. And bless you. Do you feel any pain here? Just sinuses. Any pain here? Very good. Now I'm going to look inside of your nostrils. Okay, they're pink and moist. I don't see any drainage. I don't see any lesions or anything in your nostrils. And can you clear your nose for me? Can you blow out one and then blow out? Very good. Now I'm going to have you test your smell. This is your cranial nerve 1. Close your eyes for me and tell me what you smell. Sniff in.
Vicks.
Okay. And one more. Sniff in.
Lemon.
Very good. I'm sorry, did I start on you?
No, you didn't start on me. Just something tripped on my lip.
Oh, okay. Sorry about that.
Okay.
Okay. The next thing I'm gonna do is I'm gonna check out your neck. Okay.
Okay.
Now let me ask you: have you had any problems, any pains? Have you had any stiffness or any kind of gores or anything in your neck?
No.
Okay, very good. Now I'm gonna look at your trachea. It is midline, and I'm going to ask you to drink a sip of water for me as I assess. Okay, go ahead. Swallowing is good. Okay, I'm going to assess your thyroid gland. I'm going to stand in the back of you. You don't have any pain or tenderness? Okay, the thyroid is soft. It is palpable. There are no lesions, no masses, no pain. Okay, now I'm going to ask you to, I'm going to test your lymph nodes, your preocular, postocular, occipital, mandibular, and the mental. Very good. And they were not palpable, which is a good sign, because if they were inflamed, then I'll be able to feel them. That means you might have an infection. So I'm going to touch your sternum notch. Okay, very good. Now I'm going to also ask you to, I'm going to test your range of motion of your neck. I'm going to ask you to look up to the ceiling, look down to the floor, look to your right. I'm sorry, to your right and to your left. Now put your chin to your shoulder and your chin to your left shoulder. Very good, left shoulder. Now turn to resistance for me. Very good. Turn to resistance. Very good. And that's checking your range of motion. Now I'm going to auscultate. I'm going to get my stethoscope. So I'm going to palpate your carotid. And start on this side. Okay, very good. Okay, and it was a 2+ and they were strong. Now I'm going to listen to see if to your thyroid to see if I hear any bruise. I hear no bruise, which is good. Okay, now I'm going to move on along to your thorax. I'm going to check your posterior thorax, and then I'm going to do your anterior. So could you turn towards the television, face the television, and then remove your shirt for me. I'm gonna use my hand sanitizer. Okay, right now I'm just gonna inspect the back. Can we scoop the chair up? That way, towards the okay, very good. Okay. Now I'm looking at the scapula. It is even, the shoulders are even. I see no lesions or no abrasions. And I'm gonna palpate to see if I feel any masses. Now, have you had any difficulties with breathing or any asthma or bronchitis, any shortness of breath? Okay. And you do sleep well? No abnormalities like that? You don't stop sleeping in your, stop breathing in your sleep or anything? Okay. So I'm gonna palpate here. Any pain? Can you get the camera? Because I'm on this side. Any pain? I feel no masses. No pain? Okay. The next thing I'm going to do is I'm going to percuss. Okay, I just palpate. I'm going to percuss. Okay, you ready? I'm listening for resonance. Okay. Very good. And it was resonance. Now I'm going to place my hand on your back and I want to ask you to repeat 99 for me. I'm going to test for firmness, okay?
Okay. 99. 99.
Very good.
99. 99.
Very good. Now I'm going to put my palms on your back and I'm going to elevate for expansion. Okay. Take a deep breath in and out. Very good. Now I'm going to auscultate. I'm going to listen to your breath sounds. If at any time you need to rest, let me know, okay? Take a deep breath. Very good. And your lungs were cleared to auscultation. I heard no adventitious lung sounds. Okay. Now I'm going to ask you to turn. You can turn this way for me. Facing. Okay, now I'm going to do your anterior. And again, I just want to ask you if you had any pains, any muscle, even if it's muscle pain, any kind of pain on your chest wall, anytime you feel any tightness and trying to breathe, anything like that. Okay, so I'm going to palpate your chest wall. Let me know if you feel anything. Any pain? Okay, very good. I just want to note that the rib cage is vertical, anteriorly at a 45, exteriorly at a 90-degree angle. Now I'm going to, put cups, okay? And again, I'm listening for resonance. Now the breast tissue out here, the dullness. Very good. Now I'm I'm going to auscultate, okay? Take a brief breath. Very good. The lungs were cleared to auscultation. Again, I had no adventitious lung sound. Now, I'm going to do another assessment posteriorly. I'm going to ask you to repeat the words E and then 1, 2. E is the first one as I auscultate. And then the second one, I want you to do whisper 1, 2, 3. Okay. Do E first.
E. E, 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 E.
1, 2, 3.
Oh, 1, 2, 3.
Now, same thing. E first.
E, 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 E.
1, 2, 3. Very good. And sound moves vividly through the lungs, and it was even. Okay. Next, I'm going to move on to your heart. Okay.
Okay.
Now let me ask you this: have you had any chest pain?
No, ma'am.
Oh, I'm sorry. One more thing I'm gonna do. Turn this way from my chest expansion. Breathe in. Very good. And my hands did expand, and it was equal. And now I'm going to do your heart. Okay.
Okay.
Now again, have you had any problems with any extra heart sounds? Have you, cardiovascular wise, you haven't had any palpitations, any chest pain, any tightness in of the chest, anything, nothing like that? Okay. Just gonna use my hand sanitizer again. And I'm going to auscultate. I'm going to palpate. I'm going to look at the base of the heart. Lean back for me. See, I'm going to look, see any pulsations. And I'm going to palpate the apical pulse, which is at the apex, is at midclavicular line in the 5th intercostal space. Okay, very good. Now I'm going to palpate sternal border, apex of the heart, the base. Any pain? Very good. Now I'm going to auscultate. I'm going to listen for S1, S2. The S1, the S2 is apparent and the base of the heart, the more prominent, it's the loudest. And then for the maximum impulse is of the at the apex of the heart, the maximum impulse. That's where you're gonna hear the maximum impulse, the S1 sound. The S2 is up here, and this is love. I hear love dove. It's the aortic and the pulmonic valve. This is the Eris point at intercostal space 3 and 4. Intercostal space 5. This is where the apex is. I'm going to also ask you to turn to your left side for me. Turn. Like, let me, Tamara. Can you come sit in the chair for me? Can you sit in the chair? Turn to
Left.
yeah, turn to the left side. Now I'm going to listen for any extra heart sounds, okay? I'm going to sit you up. I'm sorry. I'm going to lean you forward to see if I hear any numbers. I hear no heart murmurs and I hear no extra heart sound. The next thing I'm going to do is I'm going to move on down to the abdomen. Okay. Now with your abdomen, put your arms down to the side for me. You haven't had any constipation, diarrhea, any loose stools, or any discoloration in your stool, any blood? Okay, any past histories of problems with your stomach, nausea, vomiting, indigestion? Okay. Right now, are you experiencing any pain? Okay. Now, inspecting the abdomen, and I see no lesions, and I'm going to auscultate first, all 4 quadrants. Start off with the right lower lobe, right upper lobe, left upper lobe, left lower lobe. Now I'm going to listen to the aortic. The renal artery. and the iliac artery. And I don't hear any bruise. Now I'm going to palpate the abdomen. I'm going to feel any masses, any lumps. Any pain, tenderness. And then I'm going to percuss. And here I'm going to hear timpani. Very good. Okay, the next thing I'm going to do, I'm going to assess your legs. I'm going to do your arms first. I'm just going to sit you back up. Now I'm going to feel your arms, inspect them and palpate them. I see no lesions, no abrasions. I feel no lumps. Feel no masses. Inspect your hands, your fingers. Okay, very good. I'm going to check your axillary lymph node. I'm going to check your brachial pulses. And they are equal bilateral. Your radial pulses. They are equal bilaterally +2. Your ulnar pulses, they are equal bilaterally +2. Your brachials +2 as well. Now, I'm going to also test your range of motion as well. I'm going to start with your hands first. Can you open your fingers? Close them. Make a fist. Make a 4. Very good. And for your fingers, can you point them down and point them up to the sky? Now with your wrist, put them down and put them together like this. Very good. Can you invert it like this? Okay, very good. Can you point the wrist down to the sky again? Okay, your elbows, can you bring them in and out? And can you do that process again? I'm going to test the strength. Bring out. Very good. Bring them in. Very good. For your hands, can you turn towards strength? Okay. Now against me. Very good. Now I'm going to ask you, you might have to stand up for this. Okay, can you put your arms out for me? And in. No, down to your side, sorry. Can you put them over your head? Extend them all the way up. Very good. And back down, checking a range of motion. Can you put them behind your back? That's a range of motion for your shoulders. Very good. Now, can you, okay, you can sit back down. Another thing I'm going to do is put your hands in your lap, and I want you to invert them up and down, back as fast as you can. Very good. The skin is warm and dry to touch again. Now I'm going to check for reflexes. I'm going to check your tricep. Just hold it like this. And as I rest on, you rest it. Very good. Now I'm going to do your biceps. Push on. Very good. I'm going to do your brachial radii. Very good. Very good. Very good. Very good. Now I'm going to test vibration sensors. Hold out your finger. Spread them out. Very good. Under that hand. Very good. Now I'm also going to test. I'm gonna do the same test as before, the sensory. I'm gonna test for sharp, dull, and soft. Okay. I want you to tell me where I'm placing the item and whether it's sharp, dull, or soft. Okay. Close your eyes. You can rest, relax. Put your hands in your lap for me. Okay, good. Tell me which arm and where and what do you feel?
Right arm and dull and on my chest. It was dull or sharp.
Okay.
Yeah, sharp. And it was my forearm. It was soft and it was in my hand. Back in my hand. On my right hand. It was soft and it was in my chest, by my chest and my wrist. It was dull and it was in my forearm. And it was in my left side. It was sharp and it was in my hand and my left. It was sharp in my forearm. I mean, on my tricep. And it was on my right side. It was soft in the same spot. It was soft and it was on my forearm on the right. It was dull and it was on the same spot. It was dull and it was on my right hand. It was soft and it was on the left hand. It was soft in the same spot. It was dull and it was on my right hand. It was dull and it was on my left hand. It was soft and it was in my finger. It was soft and it was in my finger. On my left side. It was dull and it was on my, felt like it was on my tricep. Soft and it was on my tricep on my left side. Soft and my forearm on my left side. Soft and the same side. Soft and it was on my forearm and it was on my tricep on my left side.
Okay, very good. So we tested for your sharp, dull, and soft sensation. Okay, now I'm going to ask you to sit up for me. I'm going to test the strength of your shoulder. Raise your shoulders up. Okay, very good. Can I see your hands? I'm going to check capillary refill. Okay, capillary refill was less than 2 seconds. Okay, now I'm going to move on down to your lower extremities, okay? I'm going to feel for your femoral pulses, okay? No, femoral, your leg. Okay. Sorry. They are equal bilaterally, plus 2. I'm going to auscultate for any bruise. Sorry, no bruise are heard. Now I'm going to inspect your muscles. Your hair distribution is even bilaterally, which is good. Your feet are kind of cool. I'm gonna check for capillary refill. Very good. And it's less than 2 seconds. It's my hand sanitizer. Very good. I'm going to palpate your palpitative pulses. Let you relax your feet. And they're 2+ and equal bilaterally. Tibia pulses, relax. And they're equal bilaterally and 2+. And your pedal pulses, dorsal pedal pulses. And they're 2+ equal bilaterally. Now, I'm going to check your reflexes. I'm going to check your, scoot back just a little bit. Okay, very good. I'm going to check your reflex, patella reflex. Very good. Very good. Your tibial reflex. Hold up your foot. Very good. Very good. Use my hand sanitizer once again. Now I'm going to, the muscle definition is good on both legs as well. Have you had any pains? Have you ever had any broken bones, any joint pain, any crepitus in moving your joints where they crack a little bit? Okay, I'm going to do a couple of range of motions with you. I'm going to ask you to raise your leg up for me. I'm range of motion on your hip. Let me lay you back a little bit. Raise your leg up. Very good. Now to, you can do that one. Now to resistance. Very good. Very good. Now, point your heels to the floor. Okay, very. Move your toes. Push your toes. Very good. Now I'm going to straighten out your knees and bend them again, and do it again for me. Okay, again. Very good. Now I'm going to ask you to stand up for me and put one leg out here and back, the other leg out and back, and then turn this way and put one leg out that way, to the back. I'm sorry, to the back. Very good. And can you walk that way for me? You're checking your muscular skeleton and range of motion. It is patient walks easily and normally, see no abnormalities. Okay, can you hop on your right leg for me? And your left leg? Very good. Now can you walk that way, heel toe, heel toe? Patient balance. Arms out, I'm sorry, just, no. Yes, thank you. Okay. Very good. Okay, you can have a seat. Okay, now I'm going to test for senses again. Same thing as before, sharp, dull, or soft. Tell me where I do it. Close your eyes for me.
Mid thigh, dull, on the right side. Sharp on my lower leg, left on the right. Soft on my foot, right. Dull on my calf, right. Sharp on my mid thigh, right. Soft on my mid thigh, same spot. Soften my lower leg on my right. Dog on my foot. Right. Soften my foot right. Soften my left leg, lower leg. I'm gonna make the eye soft right, left. Dog on my foot, left. Soften my foot left. Lower leg, left.
What sense? Soft, don't
That's
look.
right. Dog on my same foot. Dog on my foot, left. Dog on my high, I'm gonna make that. So I'm gonna make that on my left. So I'm gonna make that on my left. So on my foot, left.
Okay, very good. Your senses are good. Now I'm gonna also ask you to stand up for me. I want you to bend over and touch your toes. Very good. Now can you bend back for me? Very good. Now bend to the left and then bend to the right. Very good. Now can you close your eyes? And I want you to keep still. See if you have any sway and doing the one bird test. 20 seconds. Very good. Now can you extend your arms out for me? Close your eyes and touch your nose with your right hand. And extend it back out. Touch your nose with your left hand. Very good. Okay, Mr. Williams, I want to thank you kindly for allowing me to do your head and toe assessment. Do you have any problems, any pains anywhere, any difficulties? Your range of motion is good. The general aspect, I really didn't see any abnormalities, but just on a regular basis, do get checked with your physician yearly and annually, and see your eye doctor for any stigmatisms, okay? Thank you again. Have a good day.